a bit like you, I guess. I got into advocacy by mistake, by what seemed like an accident at the time. And that first time of standing up and advocating for something and it having an effect and people changing their minds, or actually in the case of the UK, it was about the government taking on, agreeing to do something about Hep C and thinking, oh, actually, yeah, I can do this. I can make a difference for people. And as you say, feeling proud about it. It was at a time in my life where I was a bit kind of lost. I sort of felt I was halfway through my life. I didn't really know what I wanted to do. And then suddenly I found something that I seemed to be quite good at and that I really cared about. And I was so grateful to find like a mission in life, maybe.
Yeah, mission, exactly. Mission. When, somebody asked me, some, media or some, Anton, how do you consider what are you doing? I always think, I feel like this is some mission that I stayed alive. I started all these, treatments I pushed, and I for the access, and I received it for myself. And now when I share in my way of access and what should be changed to make this access simpler for people like me, that's my mission. And I absolutely confident if I don't know how long should I stay on this planet Earth, right? But every day my mission is to work, to advocate to do my best in terms of new people living with HIV or with Hep C or who use drugs. Found this entering point and this changing point for their lives when they start treatment.
The reason that I took the job with the Medicines Patent Pool rather than staying in the UK was that I thought probably the Medicines Patent Pool could do more good, help more people because of its mission to improve access.
Yeah. I
mean, the fact that dolutegravir is here, that sevoflurane and dolutegravir here for people with Hep C. Yeah. To make our model work, we absolutely have to work very closely with a whole range of partners. But I think it's certainly incumbent on us to make sure that governments are aware of this so that they're not wasting money.
Is there some exclusive list of diseases and medications you are dealing with? I mean, whether it's only HIV, antiretroviral therapy and Hep C, or it's also TB, or it could be any kinds of disease.
It's all about where the public health need is. And MPP is a very small organization, very, very small, and we do an enormous amount. But what we are simply not set up to do is decide what is the public health need. And we need expertise for that. And the obvious place to look is the World Health Organization, because they assess this. And one of the ways they do this is through their essential medicines list. So every 2 years, they look at what they think every country should have available for its population. And so that's really our starting point. And it covers a huge range of different conditions. So yes, not just HIV. Although back when we started, almost the only drugs on the essential medicines list that were patented were HIV drugs. And actually that expanded over time. And now they put cancer drugs and a whole range of other drugs on there. So we're looking at all these cardiovascular drugs, diabetes drugs, And often you find that there's an overlap with HIV, but not necessarily. So this is really about trying to make it possible for countries to have universal health coverage that encompasses all the essential medicines. And in order to do that, they've got to be affordable. In fact, I don't think it's unfair to say universal health coverage for low and middle income countries will be impossible unless we make drugs affordable. And that's our kind of role.